after you had that experience, was there anything, now that you're a seasoned traveler, right? You've had a lot of experience on different assignments. Is there anything that you'd suggest for a new grad that's maybe interviewing for their first position and questions that would be important for them to ask? Just because we generally try to avoid that for brand new grads where they go into the facility, and you obviously look at it as you look at it on the bright side, which is so great. And it makes you that much more adaptable and that much greater of a therapist. But for somebody that's maybe a little bit more nervous, who wouldn't thrive in that ready, set, go environment, is there any suggestions you'd have again for these new grads that maybe things that they should ask or talk about as far as getting the support at those facilities?
Yeah. So, again, I would definitely ask about mentorship, how many staff do you have on your therapy team? And if they say you'd be the only OT and you don't feel comfortable with that, I really don't recommend being the only OT there, just because, you really should have somebody to bounce ideas off of. Or, again, if you're doing the new grad program, it would be nice to have that kind of mentorship. So definitely ask about mentorship. Also, I would say, productivity standards are another big thing, because I know a lot of SNFs now have higher, and their productivity is getting higher and higher and higher. And it's, especially as a new grad, 90% productivity is just it's very hard to do. And so I would say anything below 85% try to get, if you're trying to do a SNF. But that's just for SNFs. The other settings have kind of different productivity and stuff, but that's definitely something to ask about too. I think those two are the really big things to ask.
Yeah. So I get asked that a lot too. And I think productivity standards in general are just it seems like they just get higher and higher. Some facilities even have 95% now, which just seems kind of crazy, right?
Yeah. So I think it's higher for codas, the assistants and the PTAs and stuff. Just because they're not having to do the evals and sometimes the progress reports and things like that. And they're just treating the patients. So they even have a higher productivity, and it's just crazy.
Yeah, I mean, truly. And what would you say, again, if say a new grad interviewed for a position and everything looks good? Because I get this question a lot, so I'm excited to ask you about it. But a new grad interviews for a position, everything sounds really great. It sounds like a supportive staff, but the productivity is 90%. What would you do in that situation? Do you feel like if all the other pieces seem like they're there, that would be an okay situation, or would you still suggest for a new grad maybe not going down that road?
So personally, I still wouldn't recommend it. I mean, I think it's definitely doable, but you're just going to add so much stress on top of already, having to learn the new facility, having to, you're just getting started with learning the documentation system and treating patients and just that productivity standard. Then you're focused more on getting in your minutes versus your actual patient care. So, with the 85% and lower productivity, you're going to have better patient care. It's going to be less stress on you. You're going to have more time for your documentation and things like that. Yeah. And I think it's just going to be helpful for the field in general, because if we keep accepting, jobs that are higher productivity, jobs are going to continue keeping their productivity standards at this rate. So, the more we can turn those down so that they're, kind of having to decrease their productivity standards, that's going to be huge. And I think as new grads, they're the ones that are taking these really high productivity ones in the first place because they don't know any different. And they think, oh, I think I could do that. That's doable. Or they're just, it's a job. And coming out of school, you want to take whatever you can get kind of thing. So I would be mindful of that. I really wouldn't recommend anything higher than 85%. 88, I've done the 88s, I've done the 90%, and I've also been on the spectrum of the 85 and the 80%. And let me tell you, it does make a difference. So
okay. No, that's great advice. I mean, again, I think it's hearing it from other travelers, right, helps too. So that's great. Okay.